Welcome to my YouTube channel. In this video, you are going to learn about amyloidosis. Amyloidosis is a condition. Please note, amyloidosis is a condition, not a disease. It is a condition associated with number of inherited and inflammatory disorders in which extracellular deposit of fibrillar protein is responsible for the tissue damage and functional compromise. The fibrillar proteins are deposited in extracellular space. These fibrils, that is the abnormal fibrils, are the aggregation of misfolded proteins. Along with the fibrillar protein, they deposits proteoglycans, glycosaminoglycan like heparan sulfate, dermatan sulfate, and also the plasma proteins. The entire deposition resembles like a amylose, that is starch. Therefore, the deposition is called amyloid. The amyloid is an amorphous extracellular substance, and on accumulation it produces pressure atrophy on the adjacent cells. We have already learned about the atrophy in our previous videos. Next is the properties of amyloid proteins. Actually, there are more than 20 different types of protein that aggregate to form a amyloid. There are 3 major and several minor proteins. Therefore, it is said that the amyloidosis is not a single disease. Let's see about the physical nature of amyloid. It is a continuous non-branching fibrils. Approximately it has a diameter of about 7.5 to 10 nanometers, and the structure of amyloid is beta pleated sheet conformation. Next, the chemical nature of amyloid. About 95% of the amyloid is made up of fibril protein, and the remaining 5% of the amyloid is made up of P component and other glycoproteins. There are 3 most common forms of amyloid. First is the amyloid light chain protein, that is AL protein. Next is the amyloid associated protein, that is AA protein. And the third one is beta amyloid protein, that is A beta protein. First, let's see about amyloid light chain, that is AL protein. It is made up of complete immunoglobulin or amino terminal end of light chain or both. The AL protein is mostly composed of lambda light chain, and K light chain, that is the kappa light chain, is also seen in some cases. Next, the amyloid associated protein, that is AA protein, is derived from non-immunoglobulin protein produced by the liver. The proteolysis of SAA protein, that is serum amyloid associated protein, gives rise to AA protein, that is amyloid associated protein. Usually, the SAA protein, that is the serum amyloid associated protein, bound with high density lipoprotein and will be circulating in the blood. The proteolysis of SAA protein, that is the serum amyloid associated protein, gives rise to amyloid associated protein. The level of SAA protein is increased during inflammation in response to the acute phase. Therefore, it is called secondary amyloidosis. Next is the beta amyloid protein, that is A beta protein. It is found in core of the cerebral plaque in Alzheimer's disease. It also gets deposited in the walls of cerebral blood vessels. The A beta protein is derived from amyloid precursor protein. As you have seen in the amyloid associated protein, from the serum amyloid associated protein, the amyloid associated protein is derived. Like that, in beta amyloid protein, from amyloid precursor protein, the A beta protein is derived. Here are some other proteins that deposited amyloid. First is the transthyretin, that is TTR. It is a serum protein that helps in the transportation of thyroxine and retinol. If the deposition of TTR is mutant, that is when the mutant TTR is deposited, it causes familial amyloid polyneuropathy. When the unmutated TTR is deposited as amyloid, then it is called senile systemic amyloidosis. Next is the beta 2 microglobulin. It is a component of MHC class 1 molecule. It gets deposited in or around the joint or soft tissue of the patient. Next is the misfolded prion protein, which also deposits as amyloid. Next is the pathogenesis of amyloidosis. The amyloidosis is due to the abnormal folding of protein. The misfolded protein gets degraded intracellularly by proteasomes and extracellularly by macrophages. So, during amyloidosis, these mechanisms fail, leading to accumulation of misfolding proteins. That is, it leads to amyloidosis. The protein that form the amyloid are being categorized into two. First is the normal protein that have an inherent tendency to fold improperly. Next is the mutant protein that are prone to misfolding and subsequent aggregation. Next, let's see about the classification of amyloidosis. It is classified into systemic or generalized amyloidosis and localized amyloidosis. The systemic amyloidosis involves several organ systems, and the localized amyloidosis involves a single organ such as heart. The systemic or generalized amyloidosis is further classified as primary or immunoglobulin light chain amyloidosis, secondary or reactive systemic amyloidosis, hemodialysis associated amyloidosis. First, let's see about the primary amyloidosis. The primary amyloidosis is also known as immunoglobulin light chain amyloidosis. The protein that deposit in this type of amyloidosis is AL type, that is amyloid light chain type. It is caused by clonal proliferation of plasma cell that synthesize the immunoglobulin light chain. In 5 to 15% of patients with multiple myeloma gets this type of amyloidosis. The Bence-Jones protein, that is the free light chain, is seen in the blood and urine and is also deposited in the tissues as the amyloid. Next, let's see about the reactive systemic amyloidosis, which is also known as secondary amyloidosis. The protein that deposits here is of AA type, that is amyloid associated protein. It is secondary to the associated inflammatory condition. In primary amyloidosis, we have seen that it is caused by the clonal proliferation of plasma cell, and here in secondary amyloidosis, it is caused secondary to the associated inflammatory condition. This type of amyloidosis is seen in the rheumatoid arthritis, Crohn's disease, ulcerative colitis, and renal cell carcinoma, Hodgkin lymphoma. There are several other diseases which is associated with secondary amyloidosis. Here, the SAA synthesis, that is the serum amyloid associated protein synthesis by the liver cells, is increased due to cytokines like interleukin 6, interleukin 1. When the cytokine is released during inflammation, the SAA level is increased. There are two explanations for the amyloid formation by SAA. We have already seen one of it in the forms of amyloid, that is the SAA protein is proteolized and forms AA protein. Another one is the genetic structural abnormality of SAA, so it becomes resistant to degradation by the macrophages. Next is the hemodialysis associated amyloidosis. Here the deposition of beta 2 microglobulin occur. It is seen in person with renal failure doing hemodialysis. The symptoms are seen in joints, muscle, tendons or the ligaments. We should be also familiar with another type, that is heredofamilial amyloidosis. It is the most common and best studied type of amyloidosis, that is heredofamilial amyloidosis. It is an autosomal recessive condition also called familial Mediterranean fever. A gene for this disease, that is familial Mediterranean fever, encode a protein called pyrin. From the word pyrin, you can understand it is related to fever. So it is characterized by the attack of fever associated with inflammation of serosal surfaces. Serosal surface means it include peritoneum, pleura, synovial membrane, etc. There is another autosomal dominant familial disorder which is characterized by deposition of amyloid in peripheral and autonomic nerves. Familial Mediterranean fever is an autosomal recessive condition. Please remember it. Next, let's see about localized amyloidosis. It is limited to a single organ or tissue. The nodular deposit of amyloid can be seen in the lung, larynx, skin, urinary bladder, tongue or around the eye. Here we can see the localized amyloidosis, that is the nodular deposits. And then endocrine amyloid. It is also a type of localized amyloidosis. Here the localized amyloid in the endocrine tumor like medullary thyroid carcinoma, pancreatic islet tumor, pheochromocytoma and in islets of Langerhans with type 2 diabetes mellitus. Here we can see the endocrine amyloid, which is a type of localized amyloidosis. Next, let's see about the clinical features of amyloidosis, the symptoms depend on the magnitude of deposit and site or organ affected. At first, the symptoms are weakness, weight loss, and lightheadedness. Later, the symptoms are renal, cardiac, and gastrointestinal involvement. In renal involvement, it may cause proteinuria, renal failure, and so uremia. During cardiac involvement, it include congestive heart failure, conduction disturbances, arrhythmia, pericarditis, and so on. Next is gastrointestinal involvement. When the tongue is involved, it hampers the speech and swallowing becomes difficult. It causes macroglossia, that is a thickening and broadening of the tongue. And if the amyloidosis occurs in the intestine or stomach, it causes malabsorption, diarrhea, and indigestion. If vascular amyloidosis occur, then vascular fragility is increased, it causes bleeding. And note a point, the patient who is suffering from amyloidosis survive only for 2 years after diagnosis. Like, share and comment my video. Do not forget to subscribe my YouTube channel. Thank you for watching.